That project video was wonderful, and we would now like to welcome Sampat Kumar from the Government of Meghalaya as the 2025 jury favorite in the international program of the Digital Kickoff Day. Sampat, we're so happy to have you. Welcome.
Thank you so much, Anke. Thank you. I look forward to talking to you.
So we have a range of questions that we'd like to ask you today. We hope that everybody will be interested in our discussion. Chika, do you want to start us off?
Yes, Sampo and Anke, thank you so much today. So I found your work that's fascinating, and I'm delighted to have the opportunity to learn more about your achievement. So to the first, I'd like to ask some questions about the fundamental aspects of this project. So what was the most significant that led to the launch of this project?
See, I just want to tell you like how this project has been designed. We got a new government. We got a new chief minister, and the chief minister has appointed me as the health secretary of the state. And while doing that, in fact, we also because why this was done, we also had a lot of discussion on this. We in fact, the Meghalaya is a state that was lagging behind on many developmental indicators. We have high maternal deaths, high infant deaths. In terms of SDGs, we are not doing so well. So we were one of those in terms of the performance, in the bottom in the country. So what when this task was given, it's a kind of a we need to really improve these human development indicators. So the first thing was that we had a kind of a complete commitment to bring that change from the political leadership. And also then we have to, and what I did was I took some time to take up this assignment. I took about a 2 months period to really understand what was working and what was not working in the state. What were the strengths? Our strengths of the state was when we engaged the traditional community institutions, we got some very good results, in other sectors like rural development sectors. So we also understood. So I in fact we along with a team, I wrote a state capability enhancement, a framework, how actually we can really transform the state. So based on that framework, I took the charge in 2020. In fact, I took the charge on the day the COVID was announced by the government of India that there is a pandemic coming up, and we need to really address that issue. So COVID pandemic also has given us an opportunity to deep dive into the problems, because it's a crisis, and we could able to see what was the source of the problems of many issues what we have been talking about. So the trigger was this. The trigger was that we have that strong desire to bring a change in the state. We really wanted to improve the situation that was there. And then we also actually started looking at like what was working and what is not working, what are the best practices that we can bring in. So what we did, in fact, I also have been trained at Harvard Kennedy School of Government. So in fact, we used a framework called the problem-driven iterative adaptation approach. So, and using that, in fact, we started understanding the problems more deeper. And also that framework has also helped us to really mobilize the entire frontline bureaucracy, I would say, entire frontline government functionaries to really look at the problem, diagnose the problem, instead of simply implementing the programs and the project they were implementing but not getting any results. So unless we do things differently, we cannot actually bring a change. So we found some very interesting ideas while using this framework. So to in the nutshell, what I wanted to say is that it was an intent, a strong intent of the state that wanted to bring the change, and also an opportunity like a COVID pandemic that has given us to do the deep dive. And also, of course, we have mobilized some good facilitators from Harvard Kennedy School and some, good young people, we have assembled them to really, initiate this change process. Thank you.
Great. That's super interesting. I'm curious, maybe you can say a little bit more about the methodology. Why did you choose PDIA? Why that methodology, not others, such as human-centered design, for instance, right? And were there ever frictions in that using that particular methodology, since it came from Harvard, right? And implementing these kinds of methodologies that have developed in the global north to the global south has often caused some kinds of friction. So I'm curious if you can say a little bit more about that.
Anything has to be adopted, and contextualized. So what we did was we did not implement as it is. In fact, we have contextualized. We started learning a lot about this, while using this framework. So it has, what we did, we have added some more elements into the framework. We felt while using this problem-driven iterative adaptation approach, we also need to build the local leadership. So a lot of focus was given how actually we can help people to exercise adaptive leadership, especially when you are actually encountering and solving complex problems. Because in complex problems, it's very tough to make a progress, because there are so many players would be there, so many challenges would be there. So we have designed this in a way that, like, in an iterative way, we were learning, and that way we build this particular framework. But honestly, the people who are involved in it, they don't see the framework. They participate, they participate and they see the change that what they are seeing it. And, it's kind of an infectious thing. So that way we could see the implementation. You're right, and we did not actually take any support, like from, like, I would say Harvard. We were working. We just learned some idea and we used that, the framework. But in fact, a team sitting in Meghalaya, like, for the last 5 years, we have been doing this work. Yeah.
Excellent. Wow, that sounds fascinating.
Wonderful. So, as a government officials, I totally understanding that trying to do new things is very hard, And so, when initiating the project, what kind of stakeholders did you bring together, and what discussions did you have?
So what this is very, very another important thing when you ask me what the change that we brought in terms of the, where, the way we, initiated the change process using this PDIA, problem driven iterative adaptation approach. What is required is for many problems in the government. Actually, if you look at it, the government works in silo, in a very silo manner. So basically different, organs of the, government, like we call them departments and agencies, they work. So one of the things what we did was we have actually assembled the stakeholders from all the, concerned departments, I would say, of human development. For example, when we are actually working on improving the child immunization in the state, where our child immunization rates were very, very low. So what we did, actually, we have, brought not only the health department, like the medical, doctors and healthcare personnel, but we also, mobilize the social welfare personnel, who can actually, counsel mothers, how actually, counsel parents. We also actually brought the women's economic collectives, who are, basically where where they meet often. So we used these different platforms, again, which were again promoted by the government. So we brought all of them together, started actually explaining the purpose. It's not just like, why our immunization rates were low. We started explaining that, children were dying because, if they take immunization, they can be cured for the diseases for which there is no cure. So explaining these things, understanding, telling this purpose, and the sense of purpose, bringing that entire collaborative effort, that horizontal, I would say, the relationships that we brought across the departments. So that way we brought the different stakeholders. So one, horizontal, I would say the cross-sectoral departmental involvement. Two, we also actually started working with the communities. In fact, that's again, we also felt that, the community participation is one of the important things, so communities cannot be passive recipients of the programs of the government. Communities should be the active, participants in the change process. So that's why we in fact, we completely, changed the entire, the way the government functions. Basically we brought that shift in terms of, the identity of the government functionaries. While, earlier they used to work as, as an implementers of certain programs, like, we implement immunization program, we implement, a program for institution deliveries. But instead of that, we started actually making them to see, my job is here to save mother. My purpose is to save, the child. So from implementers, they started actually assuming the role of problem solvers. So that's one important, change that what we brought. And at the same time, we also, brought that entire, change in the relationship between the state and the citizens, by proactively engaging, organizing regular field visits. That's one of the important things, like, to bring that citizen state connect, to really, to understand the challenges of the people, and also to see what they are doing innovatively, to learn from them too. It's like, we call them positive deviances, while so identifying those positive deviances. So it's a that shift that what we brought, while engaging all these stakeholders.
Wonderful. That sounds super interesting. And since you mentioned local communities, given that Meghalaya is such a diverse state, right? Just geographically, obviously, which you explained in the video, but also demographically. I'm curious, you mentioned distrust of the state in tribal communities. How did you bring people to the table who didn't trust the state, right? How did you engage that challenge to foster trust between communities and the state that didn't really exist beforehand?
So one very important thing is that, you need to, we need to connect that, I would say, the vertical, relationships between the state and the citizens. So what we did was, we've encouraged the field visits from the state officials, directly visiting the, villages and the communities. So through this process, you build trust, and we also actually understood that they have a lot of energy. So through that process, we also brought some systemic reforms. We have come out with an idea of an elected health councils in the villages. So village health councils have been brought in through this process. So what we understood is that again, there is a ability, there is a intrinsic abilities among the communities to solve many problems by themselves. So it's only thing that, like, the state needs to reach out to them. And one important thing what we did in, for bringing this trust is that, sending the frontline government functionaries, multidisciplinary teams, to the houses of the most vulnerable, people, in the sense, like the house with high risk pregnant mother. So you go as a team, a multidisciplinary team would go spend some time, 45 minutes to 1 hour, understand the problems. So it's essentially through empathy, we build that, in fact, we are building that trust. Through empathy, we are also actually building the capacity of the state, because, how to solve the problems. So it's a very one important thing is that, it's again, how actually we can bring that sense of purpose. Once you build that sense of purpose, that is the critical ingredient in our model. What we did was, we brought that sense of purpose among all the stakeholders. The moment, you bring the sense of purpose, you exercise leadership differently. You show empathy, you try to solve the problem, you try to actually don't see the, bureaucratic rules. You try to actually, in fact, basically, I would say, you would use them for the purpose than just simply, implementing, or, checking the box.
Right. I think that pregnancy or having a baby, that those stakeholders has to be having the same knowledge or same aspect about it. So how did you raise awareness about the fact that pregnancy and the childbirth are not merely routine experience, but the life and death events?
Yeah. Yeah. This is again, one of the things what we did, the state has done was that, in fact, we wanted to bring a kind of a movement, a kind of a health movement in the state. So how this would happen? So how actually people really appreciate the work that actually that a state is trying to do. So what we did, in fact, we started actually explaining the concepts of science of early childhood development, which in fact we started actually having this community level sensitization programs. We used to use like the brain wiring games where you involve the communities to make them understand that like how important it is to actually invest during the early childhood period, especially during the pregnancy, because 50% of the brain growth happens during the pregnancy period. So once they got to know about it, how important it is not to have any altercations within the family, so that that otherwise it will affect the child cognitively at a later point of a time. So taking this scientific concepts to the people in a form of especially I said the games and the lot of this communication materials, community engagement, so we could able to bring that sense of urgency towards providing a better care for the pregnant woman. And at the same time we also have used the technology. So we have especially we have created a very good health systems data. So in the state we started actually having the data of every pregnant mother who is high risk pregnant mother, how actually the moment someone is categorized high risk pregnant mother, a special care needs to be provided by the frontline government functionaries. So we use the data. In fact, we just simply, in fact, earlier they used to collect the data, but they were not using the data effectively. So when we unleashed this process, the everyone in the system started using the data to reach out to the high risk pregnant mothers, making those field visits, sitting with the families and providing that counseling support, making sure that like they reach out to the health facility well in advance, because you have seen in the video where 85% of the villages where they cannot come within 30 minutes after they start experiencing labor pain. So what we started doing is that we this again, this idea came from the frontline, some of the medical doctors working in the remote areas. They started actually bringing pregnant mothers 1 week to 10 days before their expected date of delivery, and they started actually keeping them and providing care and ensure a proper safe delivery, and they used to send them back. So we make it as a systemic reform with the kind of a creativity that was brought in through this entire process. Thank you.
That's so interesting. So in these kinds of projects, there are often a lot of frictions, right? And I'm sure you've experienced your fair share of frictions yourself. I'm curious how you dealt with these kinds of frictions between shareholders, stakeholders, but also between your lab, your team, and the government of Meghalaya, right? Are you in any way future-proofing this kind of approach for future political instabilities? If leadership changes, these projects can very quickly go away. So I'm curious how you deal with these real existing frictions right now, but also possible frictions in the future.
Yeah. No, it's a very good question, actually. This is something, the one of the concepts like for this particular idea to get implemented is that, in fact, one of the to facilitate this kind of a change process, we need to provide a holding environment for the people to experiment, and try something new. So that holding environment has been provided, as you said, like because there was a strong intent within the state. So what we did was, in fact, we also started to sustain this movement. We started investing on building political supportability. So what does it mean? We started actually, this entire, these wins, like, reduction in the maternal deaths or increase in the child immunization rates. It actually gave a lot of, motivation to the political leadership to invest more in the sector. So it's essentially in this entire change process, it should not be seen as a bureaucrat driven program. Honestly, it has to be driven by the state political leadership, because that's very important. That's why what we did, we actually, in fact, to replicate this model, in fact, across the country and other countries. I would say that we need to identify three actors for facilitating this change. One, you need to identify authorizers, those who are in the leadership positions. We need to identify the authorizers. Sorry, we need to identify authorizers. And then second, we also need to identify the champions within the system. So and then basically those, actually the champions are, in our case, the champions are frontline government functionaries, like the medical doctors and the child development protection officers, block development officers. So sorry. So what sorry, give me a second. Yeah, I'll start. So what the to replicate this change process, or how actually we can replicate it, we have actually the state under this entire work, we have come out with a 5-pillar state capability framework, where if you the 5 pillars, I'll quickly tell. One, you need to invest in citizen state relationship. You need to, that's core of everything, core of democracy. You need to invest in citizen state relationship. How actually you are building that connective tissue through that field visits, to making sure that through empathy, through creating some community institutions where citizens can participate. This is one. Number two, we also have to build that local leadership of frontline bureaucracy, especially those who are closer to the problem, should be provided that autonomy. Of course, there should be some alignment, but they need autonomy, they need holding environment, so that they can exercise leadership, they can actually identify local solutions to the local problems. This is the creativity. This is the second important thing that is required. Third important thing is that you require to use the data and research. What we did, in fact, I was while explaining early childhood development, the science of early childhood development. It's so important. The research, if you can actually take the research to the communities, which benefits a lot, and the data. If you have the data systems, you can really ensure accountability, and you can also really, the effectiveness of your interventions would increase. And the fourth one, you also actually identify every state has some systemic challenges. Like our state is a matrilineal society, and everyone thought matrilineal society should have better outcomes. But matrilineal society has a gender burden because, women takes more responsibility. They started actually having more children without any spacing. So you need to address those issues. You need to take programs. And the fourth and the fifth one is that we need to build in the political supportability very consciously in every work what we do. Then what happens is that there is a greater in fact ownership. In fact, today it's not just celebrated by the frontline government functionaries or senior government functionaries like me. Its entire political leadership is actually part of this movement. So, and this actually also helped us to really take up many more issues. This one program actually given us so much authorization to experiment on many other issues. So that's something that I would like to say. And of course, as I said, we need three actors. The three actors are everywhere, any state where you go, you identify authorizers, look for authorizers who are actually wanted to do things, has a strong intent to do things, bring change. Two, you also identify the champions, champions, especially in the frontline, bureaucracy, identify the champions. And the third one, you need some good facilitators who is good with data, who actually sit with authorizers, sit with champions, help in convening the meetings, help in actually facilitating these field visits, take notes, follow up the things. So you require a good team of facilitators, mostly the development professionals. In fact, we are very fortunate to have some people, candidates from Harvard also have come and started working with us. Thank you very much. Yeah.
Wow, so amazing. We're almost out of time, Sampath. If you could do one recommendation that you have for other countries, maybe other places in India, what would that be?
Yeah. One is that state has the immense capacity. State can mobilize, the entire functionaries around a purpose. Like, I would say, like a John F. Kennedy has given, to send man on the mission, or sorry, to send man on the moon. Or I would say, like the way John F. Kennedy has, come up with this moon mission. So we in fact, in our state, what we did was we thought, like, we need to have, how can we allow a mother to die? We should have a zero maternal mortality rate. So that's our goal. Whatever we, so if we can build that purpose among the government functionaries, we can create mission governments. So we can really see that, like, the change that we wanted to see, because there is so much expectations, especially, on the governments, because people are looking for, the governments to solve the problems. So when they look at the central authority to solve the problems, we really have to unleash that entire, the potential around the government. So I would say, one thing that I wanted to say to everybody is that government has the immense potential, and we can, we can actually really mobilize the entire government functionaries around a purpose, and we can really see the transformational, development that we all wanted to see.
Thank you, Sampath. That's a strong message for us. And also that every audience has around a lot of things from your interview. Thank you so much today. So the winner announcement will be coming up so soon. So stay tuned to see which project showcase will be invited to the President Tribe in Berlin on the 5th of June. So, and with that, thank you so much, the project team, for taking the time to meet with us, and good luck with your exciting future. Okay, bye.
Bye.
Thank you. Thank you. Bye.
Thank you, Sampath.
Thank you. Thank you, Nathan. Okay, thank you.